Debates around how the border is being handled. Texas and Missouri calling on the Biden administration to reinstate the Remain in Mexico policy. The states accused Biden's team of stalling after the Supreme Court ordered the policy to be restarted last month. The debate around booster shots continues. Millions of Americans are now eligible to get a COVID-19 booster shot. That's despite the FDA and CDC advisory panel divided over the issue. And what's the cost of COVID-19 hospitalizations? The nonprofit group Fair Health found the average hospital bill is $75,000. That's after looking at insurance claims. Tune into Deep Dive as we explore these topics and more. Hello and welcome. This is Deep Dive and I'm Tiffany Meier. Debates around how the border is being handled. President Biden saying the border situation is not who we are.
But it's beyond an embarrassment. It's dangerous. It's wrong. It sends the wrong message around the world. It sends the wrong message at home. It's simply not who we are.
Meanwhile, Texas Representative Gonzalez says migrants should be able to apply for asylum, but that there's also a need to remove people from the border.
I do believe we need to start removing people from our border back to their home country in an orderly way, in a humane way. But we need to have a process for them to ask for asylum from their home country or their neighboring country, going to embassies and consulates around the world. The process cannot be walking 1,500 miles to our southern border and rushing the river into our communities. That just does not work.
This comes as Texas and Missouri are trying to make the Biden administration reinstate the Remain in Mexico policy. Last month, the Supreme Court ordered the administration to bring the policy back. But the two states accused Biden's team of ignoring the order. Texas Attorney General Ken Paxton writes, "I have already sued this administration and won, yet they still think they are above the law and can continue shirking their responsibilities. The policy requires some people seeking asylum to stay in Mexico while they await immigration proceedings. The administration says there have been delays in restarting the program. And Mexico is increasing vigilance at the U.S. border. Agents approaching Haitian immigrants camping in a border town near the Rio Grande. They are offering to transport immigrants to southern Mexico, where they can apply for refugee status. But many at the camps are skeptical about the offer. The camp on the Texas side is noticeably smaller after U.S. authorities ramped up efforts to remove the immigrants.
Wolf, we have indeed removed approximately 1,400 people.
Secretary of Homeland Security Alejandro Mayorkas says those being placed in immigration proceedings have medical conditions or vulnerabilities. He says it also depends on capacity.
This is not a matter of immigration policy, but rather this is a matter of public health policy.
House Minority Leader Kevin McCarthy blames the surge of immigrants in Del Rio, Texas on Biden's policies.
Their journey is a direct result of the Biden-Harris agenda that wants to grant them amnesty and a lifetime of government benefits.
McCarthy said over 1.2 million illegal immigrants have been apprehended since Biden took office. Now, let's turn to another area of debate, booster shots. Millions of Americans are now eligible to get a COVID-19 booster shot. That's despite the FDA and CDC advisory panel split over boosters.
This is the sharpest disagreement that I've seen in modern history between the two agencies.
On Wednesday, the FDA gave emergency use authorization to Pfizer's COVID-19 booster for people 65 and up, those at high risk of severe disease, and of people at risk because of their jobs. On Thursday, CDC vaccine advisors met to talk about how to implement the FDA's authorization. They were unanimous in recommending boosters for people 65 and up and voted easily on boosters for long-term care facility residents and certain people with underlying conditions. As for boosters for people at risk because of their work, after a long debate, they voted against it. On Friday, an early morning announcement, the CDC director sided with the FDA on all points, including recommending boosters for people at risk of getting COVID-19 because of their jobs. CDC Director Dr. Rochelle Walensky diverged from the agency's independent vaccine advisors, recommending boosters for a broader group of people, those 18 to 64 years old, who are at an increased risk of COVID-19 because of their workplaces or institutional settings, along with older adults, long-term care facility residents, and some people with underlying health conditions. A former FDA commissioner says this kind of back and forth over boosters could have been prevented.
You might want to have a different process, and this should have been thought out from the outset. Perhaps we should have brought these two agencies together and reimagined a different kind of process where they work together from the outset to come up with unified recommendations. And I think as we go forward and plan differently for a pandemic, we might think differently about how we deploy a vaccine in the setting of a public health emergency like this.
And Biden also speaking on the issue.
Those eligible include, in addition to meeting the requirement of 6 months after the second shot, those people are 65 years or older. Adults 18 and over with certain underlying health conditions like diabetes and obesity. And those who are at increased risk of COVID-19 because of where they work or where they live, like healthcare workers, teachers, grocery store workers. That group makes up 60 million Americans who are now eligible for a booster with 6 months after their second shot.
Now, what about the cost of hospitalizations? The nonprofit group Fair Health found the average hospital bill for people who've contracted COVID-19 is $75,000. They came up with the cost after looking at insurance claims. The group found that the average bill could even be as high as $300,000. That's if ventilators are needed or if the patient has to spend some time in the ICU. But people who don't need to go to the hospital could still end up spending hundreds of dollars. That money would go towards lab work, radiology, or procedures that monitor the heart. Those costs could reach up to $2,500. But according to Fair Health, insurance providers will pay about $1,000 of that if the provider is in-network. After price negotiations, the average allowed amount actually paid by patients and in-network insurance providers is more than $33,000 for a general COVID-19 hospitalization and about $98,000 for a more complex hospitalization. Right now, the pace of initial COVID-19 vaccinations is the slowest it's been in 2 months. And for those not getting the shot because of medical and religious exemptions, how hard is it to get one? In a memo, the Pentagon is telling Coast Guard chaplains to question the sincerity of troops' faith. For example, the Pentagon tells chaplains to have the member describe how they consistently keep the tenets of their faith and demonstrate those in their daily life. Ask them to be as specific as possible. This comes from a memo the Pentagon allegedly sent to Coast Guard chaplains and made available to the Epoch Times. The memo also tells chaplains if they come to the meeting and begin by discussing concerns about safety, politics, etc., note that in the memo. The memo goes on to warn chaplains to be wary of troops who may be using their religious exemption to avoid the vaccine. It says even if the member eventually states that it is a belief based on religion, note their first expression and how they moved from non-religious beliefs to religious ones. General Counsel of First Liberty Institute Meier says such questions are illegal and calls some of them inflammatory and offensive. Barry tells the Epoch Times the government has no authority and no legitimate basis to ask the sorts of questions that are in the memo, and it demonstrates overt hostility to religious beliefs. And now before we end, the last Friday in September is also known as Save the Koala Day. It's a day to educate the public about the importance of conserving the koala's natural habitat. Even though they are called koala bears, the koala isn't a bear, it's a marsupial. It carries its young in a pouch and lives in eucalyptus trees. They grow up to 3 feet tall and weigh anywhere from 9 to 30 pounds. According to the Australian Koala Foundation, there are less than 100,000 koalas in the wild. In 2012, the Australian government deems koalas vulnerable. Some reasons the number of koalas is dwindling are bushfires, domestic dog attacks, road accidents, and the primary reason is the destruction of the eucalyptus forests. And ways to observe Save the Koala Day is by donating to a conservation group, seeing koalas at a local zoo, reading a book about koalas, or watching a movie. Well, what do you think? Let me know below. Thanks for tuning in to Deep Dive. I'm Tiffany Meier, and have a wonderful weekend.